Building health partnerships is about getting a group of people from different backgrounds together in a room to look at the local health and care services in their area.
Anyone that hasn't said anything, make sure you get a chance to get your input around the table.
We believe that in order to design really good services in health and care, you've got to have the people using those services in the room, and their voices need to be heard as part of this process.
We can learn from other people who are doing the same thing. We're one of 8 pilot sites, but it also gives us the resource and the tools to get people to tell us what they want. It's we're bringing the public to us and helping them to co-design, co-direct, co-deliver the services that we use. We get people in the room who commission and provide those services. They listen.
So we run usually a series of sessions or meetings or get together with people from a local area. And these could be groups of anything sort of between 25 right up to, sometimes in rooms we've had up to 60 people. It's a real sort of action learning, action research process, which means that people can take part in the journey at different stages. Running it over a year means that we're able to maintain momentum, really, with the priorities. So the sessions are run in a way that is very inclusive, that encourages people to talk about what they do and how they can share that and how they would like to work better in partnership.
People who they have a different hat. We call it the blobs and the squares. And the squares and the blobs can work together, but sometimes you need a blob like me to come in and say, well, this is what we could improve maybe, or this was what works, this what hasn't worked.
The other things that we really focus on are what happens between the sessions, and that in a way feels as important as getting the big groups together, because what people take away from each session and what they go away and do as a result of the conversation that they've had in the room can be absolutely key to delivering change.
Often it's the big macro stuff that's front of mind. It's just making sure that focus on the micro community is not lost in the kind of bigger picture. The strategic level of where you're deciding where funding goes for the whole health and care sector, that actually the community grassroots stuff isn't forgotten about, because it is really important. This process, bringing people together, has been really helpful to sort of see where the energy is and to be able to build on it and to sort of share that energy, because often that's what community groups really need.
We've been quite familiar with cross-sector working with varying degrees of success. I think what's been different this time is having external facilitators. So it's not always us knocking on the door. We can let somebody else knock on the door and then come in behind that. And I think that's made some of the conversations easier, and it's helped us concentrate on the discussions rather than the process around it. So really, from my point of view, it's how I would be wanting to work all the time.
Sometimes coordinating everybody's diary and just practical stuff like that can be quite difficult. But actually, if you've got that support to help bring it all together, that all you have to do then is focus on bringing what you know, which it makes life much easier when you're spinning a lot of plates. Quite often fresh eyes will see things that you don't see when you're working in it all the time.
People said that they were excited about the work that we'd been doing over the last 6 months and what we'd achieved. I can use that in my role as independent chair to talk to the other chairs and other chief executives around the whole community and say, this is what your users are demanding from you, and this is what you must deliver. Because it's so optimistic, and it is the game changer.
What I found really rewarding about the programme for me is the different people coming together, the carers in the room, the voluntary sector organisations, and the people from the NHS and the systems that sit around all of that as well, coming together with a common goal, a common passion for this. People really wanting to make a change to the way they work. And that's what this Building Health Partnerships programme has been all about.
Through this programme, professionals have been able to really hear those experiences, and you can't ignore that, and that will impact on how services are designed and provided in the future.